Okay, let's go ahead and get started with our week 3 of our onboarding classes. Last week you met with Shelly and she did some marketing stuff with you. This week we're going to go over some MFL stuff and some education. So let's dive into it. There we go. All right. So week 3. Let's go over. So the very first thing that we're going to talk about is how to label products. So whenever you get product from Stephanie, it will come just like this, or if you get it from another injector, it will have our label on it. And your responsibility as the injector, if it's a brand new bottle, is to put your initials on there, the date that it's reconstituted, and then how much you reconstitute it with. And then as a courtesy, for anyone else who uses that bottle, you just subtract the amount of units on it. That way, it makes it super simple for your own personal traceability as well. So very simple to do. It makes it easy for other injectors to use that product too if needed. Okay, the next thing that we're going to go over is we're going to talk about how you apply promotions and wallet discounts. So once you have done that patient's assessment, you're going to go in and you're going to hit take payment. Oopsies. Once you click take payment, it's then going to bring you, oh my goodness gracious, I'm sorry. Pause. It's then going to bring you to the page that has, let me fast forward. It has all the information that you put onto the patient. So we did 50 units of Dysport, and then we did our consultation fee of $55. And then in order to apply wallet discounts or promotions, what you're going to do is you're going to take your finger and you're going to slide down to pull down that little drop down box. And then you can actually click on the tabs above it where it says promotion and wallet. Now remember that Aesthetic Record is fully integrated with Aspire, but not fully integrated with Alley. Alley is Botox. So with Alley, it is a two-step process. We had talked about that on that first week. So we went over that first step with Alley. However, Aspire is fully integrated within Aesthetic Record, so it makes it very simple. So you can simply click on whatever you're wanting to apply, either a promotion or a wallet discount. And the promotions will be the different things that we offer through MFL. So if we have certain sales going on or any type of specials, that's where all of those special things are going to be is in that promotional tab. You simply just click on the one that you want to apply and it will automatically apply the discount. If you accidentally hit one in error, just tap it again and it will take it off. For the wallet, you can see that it automatically recognized that this particular patient has 600 points, which would come out to $60 off of their appointment. You can also sign the patient up for Aspire directly in the app as well. Very, very simple. I think Maggie can talk about how simple it is to do from the app. We did it at her launch party this past weekend, so very simple to do it. And every single time the patient gets a minimum of $20 off, but if they get additional things done, they can earn more and more points. The points do expire after 1 calendar year. Super simple. All right. And then the next thing is going to go over wallet. So wallet, what this is for is if a patient has Alley points. Okay. So you're going to look at the patient and you can go to the .com of Alley, or you can look on their app and you can see that they have points. And then once you've captured those rewards on the Alley website for My Face Lady, because that's how the company gets paid back, then you can go into the My Face Lady side and virtually add the money. Virtually adding the money does not collect it from the Alley side. You do have to go to the alley.com and actually capture that. So you're simply going to click on wallet and you can put in that money and either as a dollar credit or Alley points. Both of them will work. You simply take your finger and slide it over to the left and you'll click add. Put in that dollar amount. or for whatever reason you're wanting to do it. And that is how you do it. And then whenever you go to check the patient out, you're going to simply click on checkout, and then you will click on, you'll have the option for cash, credit card, cherry, and then you'll see one that says AR wallet. It will be grayed out unless the patient has funds in there. If the patient does, then you'll be able to click on it, and then you can actually capture those funds on there. So you'll see I hit checkout. And then from here, the screen might look slightly different. They just recently did an update, but it will say card, cash, care credit, cherry, green sky, and then you'll click on AR wallet if you've already put funds in there. And when you click on that, you'll have the ability to use those funds. So I clicked on it, they have $10 in there, and I clicked use. So very, very simple. Any questions on promotions or wallet discounts? Excellent. Let's talk about the difference between an enhancement and a finesse treatment. So, a finesse treatment is used 2 weeks after a patient has been treated, and it's minor tweaks. Those are for things like they might have a little bit of a spot eye, a little bit of a drop brow, and you need to add 1 to 4 units of Botox or up to 10 units of Dysport. This is not used for, hey, the patient just needs more. This is you did your injection, they got the appropriate dose, and they might have a little complication. And so that is that finesse, just trying to make it perfect for them. An enhancement, what that is for, is the patient just needs more. A lot of times, what we run into is a patient will be on a budget and then they will elect to do less units, which is not the full dosing. And if they do elect to not do the full dosing due to budgetary concerns, and then they let you know 2 weeks later, hey, I'm still moving. I think I need more. They do have to pay for those additional units because they elected to not get the units originally. So that's the difference between an enhancement and a finesse. Any questions about those? Perfect. Such a good teacher, no questions. Okay, remember as a employee, you get 55% off of your own personal treatment with the exception of the weight loss. Now, the way that it is in aesthetic record, it is 38% in aesthetic record, but you do get paid on it at that 17%, so it brings it to 55% off. So just know that you get paid on your own treatment, but the discount in AR will read at 38%, but it comes out to a total of 55%. Very simple to apply that as well. It's going to be under the promotional tab. And you have two choices. You can either get with another injector in the area and y'all can inject each other, or you can inject yourself, whatever you feel more comfortable doing. We don't allow injectors that don't work for the company to inject you, though, with our product. Just keep that in mind. All right, let's talk about the frontalis, just a little bit of education. So, whenever you are treating the frontalis, remember you have large and small foreheads. So, let me click on this. Oopsies. So with a small forehead, you're really only going to do between 4 to 5 injection points, but with a regular size forehead, you will do usually it's a total of 7 injection points, unless they get these little rainbows, and then you will add 2 more for a total of 9. As far as marking, you want to make sure that you are 2 finger breaths above the eyebrow. That is your safety zone. You want to be at or above that line of convergence. And your first injection point is going to be from the lateral canthus straight up. That is kind of your anti-spock area as well. So lateral canthus straight up, at least 2 centimeters above that eyebrow. If the patient is naturally hooded, I usually like to say 2.5 centimeters above. That way they still get the benefit of that natural lift from the frontalis. Then walking across, you're going to go medial canthus straight up, then again medial canthus straight up, and then again lateral canthus straight up. For a large forehead or regular size forehead, you are then going to do an additional layer on top. This will now go pupil straight up, nose straight up, and then again pupil straight up. If the patient does have those rainbows or those Wi-Fi's, whatever you want to call them, you will be treating with those, and they're closer to the hairline, a more superficial injection. And I usually like to treat those with 2.5 fluid units, which would be 2.5 of Dysport or 1 unit of Botox or Daxi. All right, let's talk about an eyebrow lift. So for an eyebrow lift, the muscle that we are going to be treating is the orbicularis oculi muscle. Remember that nature naturally made that orbicularis oculi muscle to be a depressor muscle group. It is responsible for closing your eyelids and your eyes. And so when you put neurotoxin into a depressor muscle, it forces it to do the exact opposite. Now it becomes a very strong elevator muscle. So when we are treating a brow lift, there's two different ways that we can treat it. We can do it the very tail of the eyebrow to give a little bit more of a cat eye look, or we can go about 1 centimeter in to open the eyebrows more up and out. Now, you're going to watch a quick video of Dr. Tim Pierce. He's one of my favorite people as far as education goes, just to talk about how he does his eyebrow lifts, and you can see exactly what he does as well. So we're going to watch a little video on this. Please give me a thumbs up to make sure that you can hear.
I recently posted a video on how to do a brow lift, and many of you asked questions on how I was able to inject underneath the eyebrow and not cause an eyelid ptosis. Now, unpacking this is a very interesting way of understanding the anatomy because, of course, we are all very afraid of causing eyelid ptosis. Now, many years ago, when I first started training, I remember training an ophthalmologist who told me that they injected the eyelid close to where I was just warning my trainees to be careful of injecting, and they used 4 units, so 4 times more than I would normally use, and he'd never had an eyelid ptosis. And this really got me thinking much more about the anatomy. So by the end of the show, if you watch it all, you should understand the nuances of different muscles and how they are differently affected to what you may have first thought when you first learned how to inject Botox in this area. So many people were concerned that my injection points were so close to the eyelid that I may cause an eyelid drop. Now let's first consider what actually happens if you inject the eyelid. So people have purposefully injected the eyelid with toxin, and you'll be surprised to find out, if you didn't know this already, that what will actually happen is your eyelid will actually lift. And that is because the superficial muscles that are in the eyelid are actually the protractors of the eyelid. They are not the retractors. So the retractor muscle is the levator pulpebri muscle, which runs in the orbit. And this is what we are concerned about not injecting. Whereas the orbicularis oculi, which actually runs in the eyelid, if you inject that, actually allows your eyelid to open slightly, because when you close your eyes, it's contracting, you relax it, it actually opens. So it's actually the reverse of what many people think, because they haven't thought about where the muscle that lifts the eyelid actually lives, which is in your orbit. So understanding this is the first thing around why you don't need to worry too much around eyelid ptosis. But there are other elements too, because of course we can get eyelid ptosis from injecting superior to the eye. So we need to think about what injections are likely to be causing that and what we can do to avoid it, and why my style of injection in my career has never caused an eyelid ptosis in any of my patients. So that's part one of what to understand. We need to think about which muscles are likely to be involved and what injecting toxin actually does to them. If you're injecting superficially and you inject orbicularis oculi, you will find the eyelids actually more likely to lift. In fact, it's now a treatment for eyelid ptosis when you've injected the other muscle, the levator pulpebri muscle. Knowing precisely where these muscles are and what layer they're in will give you confidence to inject in areas where other less thought out clinicians will think you're going to get an eyelid ptosis. So let's think about the layers in this area. Obviously at the top you have the dermis, then you have a thin layer of fat in the hypodermis, and then you have the orbicularis oculi muscle. Underneath that there's the retroorbicularis oculi fat pad, then you have the orbital septum, and underneath that you have the preseptal fat pads, and underneath that you have the levator pulpebri muscle. So there are actually multiple layers. So to help you understand this, let's think about the face and the anatomy in this area, not with all the difficult medical terms, but just as a sandwich. Imagine that you're having a sandwich on your mum's favorite tablecloth. That represents the most precious part of the anatomy, the orbit. We don't want to get ketchup on the precious tablecloth. And of course, if you make your sandwich directly on the tablecloth, you're going to make a huge mess and cause your mum a lot of upset. or your dad. Might be dad's favorite tablecloth too. But what we actually do in real life is you have layers that protect that tablecloth. We have a placemat on top of that. You could think of the placemat as the preceptal fat pads. And on top of that, you have the plate, which you can think of as the orbital membrane. On top of that, you have your first layer of bread, which is the retroorbicularis oculi fat pad. On top of that, you may have the meat, the muscle. On top of that is where we try and put our ketchup. And one layer on top of that is the dermis. So actually, the ketchup is shielded from the tablecloth by multiple different layers. And it's exactly like that with injecting botulinum toxin. We're actually injecting tiny amounts just on top of the muscle, and we have multiple other layers shielding those important structures in the orbit. And it's the depth of injection rather than the position relative to the eyelid that keeps those internal structures safe. Another question that we got many times was, how many units do I like to place in the dots underneath the eyebrow? I find it really helpful using just a 1-unit dose, and this is enough to get a difference. I'm not necessarily trying to paralyze the bulk of the muscle. I just want to affect those fibers that are pulling the eyebrow down. This is also a safer amount. It's a bit like, to go back to our analogy, like using less ketchup. You're just less likely to get an inadvertent mess. So small amounts, wherever you can use them, are always safer. As a general rule of thumb, the dose response curve is less likely to cause you a problem. So that's why I use 1 unit. I typically use 1 to 3 units underneath the brow, and then I'll use my stronger doses where the licensed dose is higher at the lateral canthus. In terms of dilution, I usually use the standard dilution of 2.5 mils in 100 units of botulinum toxin, but sometimes I'll use a more concentrated form if I'm in an area where I just want to make sure there's less chance of a spread. But I used to do that a lot more than I do these days. I've had so few complications that I very rarely use different doses. When I do use the more concentrated version, it's in the lower face. Injecting the depressor angularis oris or the mentalis, I feel safer using a more concentrated dose. For most of the rest of the face, I dilute 100 units with 2.5 mils of bacteriostatic saline. Another question we got was, does the brow lift occur from injecting below the eyebrow or also from injecting above the eyebrow? And in fact, years ago, I had patients who would come and say, no, I've had an eyebrow lift, the doctor injected here, you have to do the same in order to get a lift. Now, if you think about the anatomy, this cannot be true because these are the elevators. And if you inject the elevator of the eyebrow, you're going to decrease the power of that muscle to lift. So you're actually more likely to get a drop. And in fact, most of us are very afraid of injecting directly above the eyebrow in the frontalis muscle because that is where you lose the eyebrow arch. So you only get a lift when you affect the little tug of war that's going on with the eyebrow between the two muscles. One's an elevator, one's a depressor. So if we weaken the depressor, which is the orbicularis oculi muscle, and you can see this because if you want to lower your eyebrow, shut your eyes very tightly and you will see your eyebrow comes down, and that's caused by orbicularis oculi. And the frontalis muscle does the opposite. So the tug of war is won by reducing the strength of the depressor, which is orbicularis oculi, not by treating the frontalis muscle above it. However, the other way we create eyebrow lifts is by increasing the resting tone of the lateral frontalis muscle. And this is done when we treat the middle of the frontalis and the lateral gets more active. So in some of my videos, you'll see that I draw cat ears, we call them, and I tell injectors generally not to inject in those cat ears. Now, those cat ears represent the elevating part of the frontalis muscle. So when I say that it reduces the chance of a ptosis, I'm talking about a brow ptosis, not an eyelid ptosis. And this is one of the biggest confusions that happens earlier on for people, is differentiating between a drop in the eyebrow and a drop in the eyelid. And nearly all of the cases I get sent are actually drops in the eyebrow, not in the eyelid. The actual eyelid is stable, but it's rested on by a heavy eyebrow. Typically, if they have extra fat above their eyes and that's resting, or they have an eyelid shape that just naturally transmits energy into the eyelid, it confuses injectors. But that is all to do with reducing the strength of the frontalis muscle in this crucial area that elevates your eyebrow laterally. So the more botulinum toxin that you place in this area, the more likely you're going to have that problem. And so particularly in females and not so much in males, I don't treat that area because I want there to be an eyebrow arch. Females also tend to use their eyebrows in a different way to men, which is to do with applying makeup. Every morning, if you apply makeup, you tend to lift your eyebrows up, whereas men do not notice the loss of movement laterally. So you can actually treat men quite often with more Botox in the cat ear and weaken the frontalis muscle all the way across, and it does not cause any problem or concern at all, whereas a female will miss that ability to raise their eyebrows and apply makeup. Other injectors were concerned by not treating the cat ear area that you may then cause a Spock brow. And in fact, this could be part of a Spock brow. Typically, I think of a Spock brow as a medial brow ptosis and a lateral brow lift. So if you overtreat the middle and undertreat the side, then absolutely you get this disequilibrium, and you have too much activity and too much heaviness in the middle, and that creates this unpleasant shape. So it is possible that you could be on that spectrum. Like everything we do, you're trying to make the adjustments to get a happy medium. So I want a little bit of a brow lift, not a huge one, and I adjust that sometimes by putting one unit in the top of that triangle of the cat ear, and that's typically what I'll do when I know the patient or when I'm confident that they have quite a strong frontalis. I will treat within the cat ear area. I think sometimes people see these markings and they think it's a definite no-go area. It's actually not. It's just an area that I'm more cautious of injecting, and it's helpful if you know you're creating an eyebrow lift, and if you don't know the patient, to start with leaving it undertreated and then to treat them at a follow-up and then make a note of where that treatment was. So then you have a plan that will work each time you see them. But the first time you treat someone, particularly if they're a little bit older and brow drops a little bit more likely, it just makes sense to see what happens with those units, get the result back in 2 weeks, and then make an adjustment, learn from it, and then you can repeat safely whatever you learn from that patient in the first course of treatment. So I hope that's helped you understand in more detail the 3 important muscles, particularly with respect to eyelid drops. So we've got the levator pulpary muscle, the orbicularis oculi muscle, and the frontalis muscle. And if you take away anything from this, it's the 3-dimensional injection depth that matters most in terms of safe injecting around the eye.
Alrighty. Any questions about what he just talked about? Perfect. Next thing that we're going to go into is a quick bunny lines. So for bunny lines, what I like to do for the bunny lines is I like to actually inject while the patient is in contraction. The reason why I do that is because it makes it a little bit more comfortable for the patient. So you can see how she's kind of squinching her nose a little bit. That just kind of helps give you a little bit more meat to work with. This is considered a small muscle group. So you really are only going to be injecting with 2.5 fluid units, which would be 2.5 of Dysport, or it would be 1 unit of Botox or Daxxify. Very small, you're just kind of chasing those little lines. Again, those are called the bunny lines, and they are caused from the nasalis muscle that go across the bridge of the nose. You can also have another bunny line that's caused from procerus. It's at the very bottom of procerus where it integrates into that muscle right there at the very bridge of the nose. You can also get a little line, horizontal line there as well, and people refer to it as a bunny line, but it is caused by the bottom part of procerus. So that's just another quick little review. All right, 2 more videos and then we're going to be done for tonight. I know it's a longer call. I apologize. So this next video that we're going to watch, this is about the MD needle pen. So this is the particular pen that we use for microneedling. So it's really important that you know how this device works and that because you are going to be using it on your patient.
What is microneedling with the MD needle pen? Microneedling, also known as collagen induction therapy, stimulates the body's natural healing process by creating microchannels on the surface of the skin. This procedure leaves the top layer of the skin intact, allowing for shorter healing time and the ability to treat many different skin concerns. Each microchannel allows for the absorption of serums, hyaluronic acid, and PRP when used during the treatment. The body is stimulated to fill these microchannels by producing collagen and elastin, resulting in smoother, firmer, and rejuvenated skin. The motorized technology of the MD needle pen has the ability to adjust the sterile needles to depths ranging from 0.25 to 2.5 millimeters. These variable depths allow for the treatment of deep wrinkles and acne scars, in addition to delicate areas around the lips and eyes. Microneedling is an effective treatment for many skin concerns, as we can see by analyzing these real-life before and after photos. Before treatment, observe that the acne scars are very deep and pigmented, but after microneedling, the skin is smoother and pigment is diminished. Notice the pronounced smoker's lines here before microneedling. After treatment, the lip lines and wrinkles are minimalized. Here we see increased skin laxity and rough texture before treatment. Once microneedled, the skin is tighter, firmer, and smoother. See the sun damage and uneven tone in this patient's skin before treatment? After microneedling, pigment is lightened and the skin tone is more even. Notice the brown spots, wrinkles, and skin texture before treatment. After microneedle therapy, aging skin is less crepey with reduced dark spots. Before treatment, we see stretch marks that are very dark and highly visible. After needling, they are smoother and the color is less prominent. Before treatment, there is a noticeable shortage of hairs on the scalp. After skin needling, the number of hair follicles is dramatically increased. Clinical studies have shown microneedling as a safe and effective alternative to ablative laser treatments. With no thermal injury to the skin, a short healing time, and the ability to treat any skin type, it is a skin transformative procedure for every person. Clinical specialists designed the MD needle pen with durable stainless steel outer shell for reliability and gave it the ability to be used corded or cordless for flexibility. The surgical-grade stainless steel needles are individually sterilized for patient safety and comfort. MD Needle Pen is committed to patient results and has developed unique advanced protocols from actual in-office procedures. To learn even more, we have a clinical study underway with Shriners Hospital for Children for the treatment of hypertrophic burn scars. Microneedling is a safe and effective skin rejuvenating procedure that uses the body's natural cellular regeneration to stimulate collagen production. If you are interested in this unique anti-aging treatment that tightens, lifts, and smooths the skin, visit us at mdneedlepen.com or contact one of our local practitioners.
Perfect. And then last video of the night, this is the perfect derma peel. So this, once you watch this video, this is the way that you can actually go ahead and start offering this to your patient. Maggie, these would be a great thing to offer at events as well, especially if someone is scared of needles and they don't want to do anything that involves needles. This is a great thing that we can offer as well. So we obviously have the IV hydration, you have the chemical peel, we have microneedling, we have obviously the toxin and fillers, and then we have weight loss for our APCs. We are looking at ways for the nurses to be able to capitalize on that, so stay tuned for that. We are just running some things by the legal team. You wouldn't obviously be able to prescribe, but there is a way for you to hopefully kind of follow up and help manage with the APC, and so that y'all can capitalize on that. So just know that that's hopefully coming down the pipeline. So this is the last video that you are going to watch, and it's called The Perfect Derma Peel.
Welcome to the Bella Medical Products training video. In this video presentation, you will meet some of our corporate staff, receive additional product information, hear testimonials, and view demonstrations of the Perfect Derma Peel application. Founded in 2011, Bella Medical Products is dedicated to formulating innovative, result-oriented skin solutions for the aesthetic medical industry. Ranked as one of the top 3 new anti-aging products of 2011 by ABC News, the Perfect Derma Peel delivers healthy, ageless skin for all skin types and ethnicities. Bella Medical Products advocates the practice of less invasive cosmetic treatments by providing cutting-edge products to plastic surgeons, dermatologists, cosmetic physicians, and other medical professionals. The Perfect Derma Peel and the Perfect Skincare System product line allow us to offer an exciting new future for skin transformation.
The Perfect Derma Peel is my go-to peel for all of my clients because of its versatility for all skin types and skin issues. I love how the Perfect Derma Peel has little discomfort, and with such little downtime, the results are dramatic.
My clients have benefited from the Perfect Derma Peel for several years now. Applying the Perfect Derma Peel is very easy, and our patients are thrilled with the results.
The Perfect Derma Peel by Bella Medical Products is committed to providing skincare products that deliver superior results to the aesthetic medical community. The Perfect Derma Peel is a safe and effective treatment for aging skin. and is the only peel to feature glutathione, an antioxidant with powerful anti-aging benefits. The Perfect Derma Peel is available throughout the U.S. and is growing in popularity worldwide.
Hi, my name is Lana Petrovic. I'm the Director of Operations for Bella Medical Products, and I'm going to explain to you some of the benefits of the Perfect Derma Peel. The Perfect Derma Peel will improve the overall clarity, tone, and texture of the skin, reduce or eliminate hyperpigmentation and melasma, control acne, remove or reduce sun damage, soften fine lines and wrinkles, and minimize the appearance of pores. The Perfect Derma Peel is beneficial for all skin types and all ethnicities.
I feel very comfortable using the Perfect Derma Peel because it's very safe, and at the same time it's very effective, very result oriented.
The Perfect Derma Peel is one of the easiest peels I've ever performed. I've been giving peels for 20 plus years in this business. It's 1, 2, 3 easy. It's a half-hour process. They're fairly comfortable throughout the entire procedure. It's great. They're up, they're gone, they're fine. They absolutely love the result. It's a great thing to do when you're preparing to go on a vacation or a wedding. Anytime you want your skin just to look flawless, they absolutely love the Perfect Derma Peel.
Hi, I'm Michelle Ray with Bella Medical Products. The Perfect Derma Peel is a medium-depth medical-grade peel featuring a unique blend of acids that address many common skin concerns. The peel contains TCA, retinoic, salicylic, and kojic acids, phenol, vitamin C, and antioxidant glutathione. Each acid is under 12%, and the peel is pre-mixed for easy application.
I really enjoy working with Bella Medical because the customer service is amazing. I mean, I've never had any issues. It arrives on time, the product is consistent, and they're really easy to work with.
I am Nafis Sabai, the founder and CEO of Bella Medical Products. We are committed to providing skincare products that deliver superior results to the aesthetic medical industry. We are happy to welcome you as a provider of the Perfect Derma Peel.
Hello, my name is Juliana Wagner. I am a licensed esthetician of 20 years, and I'm also the senior trainer for Bella Medical Products, and we're here to do the Perfect Derma Peel today. So Natalie has concerns with fine lines and wrinkles, so we're going to do the Perfect Derma Peel on her today to bring back that healthy glow to the skin. So what we prep the skin with prior to the peel is 100% pure acetone. It degreases the skin so that the peel gets down into the skin evenly and deeper into the skin as well. I'm going to have you hold your breath and tuck your lips, please. Any areas of concern, such as fine lines and wrinkles, as well as hyperpigmented spots, deeper lines, you want to be more aggressive with your acetone in those areas, again, to get that peel down in there to do a better job. A good 2 to 3 passes is necessary. Next, we're going to go ahead and put the peel into the cup here. And you're going to want to apply it with one of the 2x2s that come with the peel. And you're going to fold it into a little bit of the square. In our first pass, we're going to go lightly just to numb the skin. How are you feeling, Natalie?
I'm good.
Good. So the active ingredients in the Perfect Derma Peel is the TCA, salicylic, retinoic acid, vitamin C, glutathione, kojic acid.
It's kind of tickle now.
And with the phenol in there, you don't have to have the pain.
Yeah.
We're going to feather into the neck 1 to 2 layers, and directly underneath the eye 1 to 2 layers as well. I'm going to have you look up towards me, please. And go ahead and close and relax. You're going to layer the peel till it's gone. You're going to look for frosting as your end point, as well as erythema. You want to redip often into the cup so that it stays nice and even throughout the peel. Maybe look up towards me, please. And that'll be the last layer underneath the eye as well into the neck. And then we'll finish the peel throughout the rest of the face. Almost done here. And you just want to work it through once your cup is empty till your gauze is practically dry. And that's it. As simple as that. So next, we're going to go ahead and go over the post-peel kit with Natalie. Natalie, the peel is supposed to be left on in 6 hours. It self-neutralizes. So you can wash your skin in 6 hours, but preferably I'd like you to go ahead and leave it on overnight if you're not uncomfortable in any way. In the morning, I'll have you wash with a very mild cleanser, and then you're going to go ahead and I'm going to recommend that you take one of the 2 towelettes that are in your post kit. I'm going to hand you the directions as well. And this is a towelette that you're going to use on clean, dry skin tomorrow morning. And this has vitamin A, so it's going to help to expedite the peeling process. So we'll go ahead and you'll use the towelette fairly aggressively. You're going to rub throughout, make sure you get under the eyes really well, and also feather it into the neck. You're going to go ahead and wait at least 30 minutes before applying any sunblock on top. And then you're free to wear makeup that day if you choose. Then that evening, I'm going to have you go ahead and I'm going to have you cleanse again with something mild again, and then go ahead and use your second towelette. And again, very aggressively, you want to rub it throughout the face, feather it into the neck and under the eyes, and then just go ahead and sleep with that on overnight. Okay. Then after that, the next day you're going to start to see that you're going to start to peel around the mouth. And that's where we talk and move our skin the most, so it'll peel first, and then it's going to kind of just slowly peel out for you. So during that process, you're going to use the hydrocortisone 1% cream that's in the kit as well, and that's all you'll need along with your sunblock. Okay, and then it is a 7-day process, and then you're going to just look beautiful and glowing as you naturally are.
Thank you so much.
All right, thank you. Prior to the application of the Perfect Derma Peel, it's important to go over the contraindications with your patients. Contraindications include pregnancy, breastfeeding, Accutane use within the last 12 months, hypersensitivity to any of the peel ingredients, or aspirin allergy. Do not apply to skin that is still irritated from any harsh treatments such as lasers, waxing, electrolysis, or chemical exfoliants. Do not apply to open wounds, sunburn, infected skin, cold sores, herpes, or lesions. It is important to advise patients with a history of cold sores to be given an antiviral prior to the peel. For overall rejuvenation, we recommend doing the peel no more than 2 to 4 times per year. However, for chronic conditions such as acne, hyperpigmentation, melasma, and concerns with fine lines and wrinkles, we do recommend a series of 3 peels 30 days apart. For thicker and more resilient skin types, melasma, and acne scarring, we recommend adding the Perfect Derma Plus Booster to the peel solution for optimal results. The peeling process will vary per person based on skin type and skin condition. The peeling process will start within 48 hours, intense peeling for 2 to 3 days, and an additional 2 days remaining with the residual around the hairline and neck areas.
If you have any additional questions or need more information, please feel free to contact your local sales rep or our corporate headquarters.
All right. Any questions about the Perfect Derma Peel or, wrong button. Oh. Any questions about the Perfect Derma Peel? Perfect. We are almost done for the evening. Okay. So this is something that I like to talk about. This is for the it kind of goes into the marketing as well, what Shelly had talked about. But this is kind of more focused on some different ideas and things that you can do. But one crucial thing that I want you to do is I want you to start your social media following. I want you to be a sponge and follow as many people as possible and learn all the different ways that you can inject. I obviously taught you a certain way in training, but as you progress through your aesthetic career, you're going to find that people inject differently than me, and that is absolutely okay. So I want you to try to be a sponge and learn as much as you can. So these are a couple of the injectors that I want y'all to start to follow. This is recorded, so you can always go back, but if you want to take a quick screenshot of these people, so there's 2 here. And then also there is 2 more on this page, and then there's a podcast. Obviously, I like Tim Pierce as well. He's excellent to follow. And then you can see some of the different before and after marketing things that you can do. You can talk about education for chemical peels. You can post before and afters, and we'll have a whole slew of graphics for y'all too. Shelly and Ashley and I are working on a Google file that will just dump all these graphics so you can just kind of go and grab them. And our marketing team is helping as well. So that will be up and running hopefully in the next week or so. But these are just some different ideas that you can do to kind of help get yourself out there. Kind of like I've said in the past, you know, as nurses, unfortunately, we are not fantastic at marketing ourselves and putting ourselves out there. So we really have to get comfortable with getting uncomfortable. Now, that leads me into the very last person on this page, and this is Jessie Lee. She was actually a podcaster. She passed away, I think, 2 years ago, but she was more in the multi-level marketing realm, but the woman's brain was phenomenal. Just the way that her brain worked and her business mindset. Now, she does cuss a little bit, so if you're around little children, you might want to put little earmuffs on them, or just maybe put her in your headphones. But she has some great tips and tricks of just how to get out of your own head and put yourself out there and really kind of put your business cap on. So if you love listening to podcasts, I highly recommend Jessie Lee. She's fantastic. And the very last thing that we're going to be watching today is just how to sign people up for that VIP membership. It's very simple to do. You can do it directly from the app. So go ahead and search for that person, and then you can hit those buttons in that three upper right-hand corner, and you click on memberships. When you do that, you are then going to click on the new in the upper right-hand corner, and you will simply walk your way through everything. It is pretty self-explanatory. You're going to pick yourself as the primary injector. You'll make sure that the credit card information is correct and stored into the patient's profile. And then you will select the start date. You can absolutely start at the day of the appointment. It will be $50 to sign up, and then they get $50 off every single month after that, plus an additional 5%. So it does bank that $50. So every single month it banks at $50. And then it goes away, or it rolls off at a 12-month rolling period. So it's not just for 1 year, like from January to December. It is a full kind of rolling 12 months. So just kind of know that. So you either use it or you lose it. It's a great way when patients have, $300, $400 sitting in there. You can say, hey, let's get your toxin booked up so that we can make sure that we use all of your rewards. So if you have patients that are saying, toxin is expensive, and I totally understand toxin is expensive. It is definitely an expensive habit that a lot of us have come to love. But this is a great way to kind of help ease that cost as well. All right. So that is it for this week. I know it was a little bit of a longer call. I apologize. Hopefully I didn't lose y'all, but we want to try to give you as much information as possible. Again, this is being recorded, and so that way you can always refer back to it. I will upload it tomorrow, and that way you can rewatch it and fast forward it as many times as you want. I hope you all have a wonderful evening. I will go ahead and stop the recording now, and if y'all have any questions, I will hang on just for a little bit. Bye, guys.